everyone, my name's Katie, also known as Miss Pink Pops Away. I'm currently a student at California State University, Sacramento, studying nutrition. However, my dream career is to one day become a dermatologist. Today for this video, I'm going to be discussing skin conditions associated with each layer. So to begin, there's three main layers of the skin, including the epidermis, the dermis, and the hypodermis. One skin condition associated with the epidermis are epidermoid cysts. They're not dangerous, and they come in a variety of different sizes, as you can see by this picture. And basically what's happening here is instead of those dead skin cells shedding to upper layers out of the body, the dead skin cells actually get trapped and shed into deeper layers of the skin. So all of this here are dead skin cells that form together in a sac. And the sac contents, as you can see, are soft and a yellowish substance. And what we can see in here is keratin. And they're typically painless, but as you can see, they vary in size and are most commonly found on the face, neck, chest, back, and genitals. And this is actually a picture of an epidermoid cyst on the testes. Another skin condition associated with the epidermis is ringworm. It's also known as tinea or dermatophytosis. It's a ring-shaped rash on the outer layer of the skin. It's affecting that most superficial layer, the stratum corneum, and it causes dry, cracked, itchy skin. It's typically not dangerous. However, if left untreated, it can spread to other parts of the body and can be contagious. And it's not actually a worm, but a fungus that comes from a common mold-like parasite. So typically most topical antifungal treatments can get rid of this. And another skin condition associated with the epidermis is the basal cell carcinoma. It's the most common type of skin cancer that people come across. And it actually forms in the stratum basale or basal cell layer. And it is due to UV radiation coming down and damaging the DNA of the cells. And what's interesting is it's not actually basal cells that are affected, but they're cells that look very similar to basal cells in the stratum basale layer. And these damaged cells then multiply uncontrollably and just can spread to other parts of the body. The appearance of the basal cell carcinoma also dramatically differs, so these are all different pictures of basal cell carcinoma. And another type of skin cancer associated with the epidermis is the squamous cell carcinoma, and it is the second most common type of skin cancer. It's also caused by UV light damaging squamous cell DNA in the epidermis. You can get squamous cell carcinoma in other parts of the body outside of the skin, but the skin is the most common, and it's usually not life-threatening but can be aggressive. And it's the same process where the UV light damages the DNA, and then the cells multiply uncontrollably to other parts of the body. And then we also have melanoma. This is not as common of a skin cancer, but is the most dangerous. And it has the same process where UV light damages the cell. In this case, it's the melanocyte in the basale layer or basal layer. And these damaged cells multiply uncontrollably and rapidly throughout the body. It's very aggressive. And this is just an example of how you can tell whether a mark you have is normal or it's not. So if you see any type of mark that's asymmetrical or has uneven borders or has multiple different colors or is greater than 1/4 of an inch, you should most definitely get checked because there is a chance of having melanoma, and anyone who has a lot of moles, such as myself, has an increased chance of getting melanoma. And some skin conditions associated with the dermis. First, we're going to start with the pilar cyst, which is actually one of my favorite skin conditions to watch on Dr. Pimple Popper when Dr. Sandra Lee treats these. They're usually not dangerous, and it's the most common type of cyst. As we mentioned earlier, what's happening is those dead keratinocytes are going from the stratum basale layer and are shedding downwards into a lower layer. And so this is just a makeup of dense skin cells, and it develops from the epithelial lining of the hair follicle in the dermis. This most often occurs on the scalp with 90% of the cases. It can be hereditary, but is most common in middle-aged women. And in order to remove any type of cyst, they have to remove the entire sac, which is this component here, or the cyst can grow back. Another skin condition associated with the dermis is the comedo. It's not dangerous. There's two types, the open and the closed comedo. The open comedo is the black head, as we can see here, whereas the closed comedo would be the white head. And it's not black due to dirt or anything like that. It's actually the melanin pigment coming from the melanocyte, which reacts with the air and then turns this area dark. so it's not dirt. However, if left untreated, the blackhead or open comedo can get larger, and then we could get the dilated pore of Weiner, as we can see here, which is just basically a very large blackhead. And then here we could see the whitehead or closed comedo, and it's due to a complete blockage of the hair follicle, whereas this one has a partial blockage. And it occurs when the hair follicle in the reticular layer, so the lower layer of the dermis, has become clogged with oil or dead skin. And other contributing factors could include hormones, genetics, stress, diet, as well as the bacterium that's common in the hair follicle shaft, the Propionibacterium acnes. Another skin condition associated with the dermis is rosacea. It can be serious, but it's typically not. It's a common skin condition where skin appears to be red or flushed, but it's actually due to broken or inflamed blood vessels from the dermis layer. There is no cure for this condition, however, there are treatments available. However, it can spread and get worse if left untreated. It can lead to rhinophyma. It's more common in males, and basically it's an overgrowth of skin tissue in the nose. And here's an example right here. Another skin condition associated with the dermis are wrinkles. They are not dangerous at all. It just naturally occurs with aging due to a breakdown of the connective tissue inside the dermis. However, overexposure to UV rays and smoking are the main causes of premature wrinkling. Some good tips are to stay hydrated, reduce stress, consume more antioxidants in the diet, such as vitamin E, and make sure to not overexpose yourself to UV rays with tanning either in a bed or outside in the sun. And then the last layer of the skin is the hypodermis, or the subcutaneous tissue layer. So there's also some skin conditions associated with this layer. For example, a lipoma. It's not dangerous, it's just a benign fatty tumor. A lipoma is a slow-growing, painless fatty mass, and it's most commonly associated with the hypodermis. It can be triggered by an injury to the subcutaneous tissue, but there's also a genetic component to it. So if your mom has a lot of lipomas, there might be a chance that you might also be predisposed to having this condition. And it appears as a very movable, squishy lump on the outside of the skin. You do not have to have it removed, but some people like to. Another skin condition associated with the hypodermis is cellulitis. This can be very serious. It's a common skin condition, but it's very painful. It's caused by a pathogen, often either Streptococcus or Staphylococcus bacteria. And this bacteria will invade the skin and damage deeper layers of the dermis and hypodermis. And it causes this appearance of a red swollen area, and it's very warm to the touch. This often occurs in the lower legs, but it can occur in other parts of the body as well. It's important to get this treated, otherwise it could lead to a blood infection and cause sepsis or lymph node destruction. And then the last skin condition that we're going to be discussing associated with the hypodermis is the subcutaneous abscess. This can be serious. Other abscesses are usually associated with the dermis. It's caused by a pathogen. It could be a bacterium, a fungus, or a parasite, and it damages the subcutaneous tissue and causes an infection. This area fills up with pus and is often very painful and must be drained and treated with antibiotics, or an infection can spread and cause more serious issues. So I hope you enjoyed this presentation on the skin. If you have any questions, feel free to contact me on my website, and thank you for watching.